Hi, guys. Welcome back to the final podcast of the Live, Laugh, Lockdown project. Today, we will be talking about therapeutic music and music therapy, which, they sound very similar. It's just the two words switched around. But there's actually quite a big difference between them. And so that's what we're going to be discussing about today.
Yeah, so me and Gabrielle, learned a lot about like the difference between music therapy and therapeutic music. So I kind of gathered some information from that class that our professor has given us um, to really make the two clear. So what this whole project is about is more about therapeutic music versus music therapy. We're gonna get into a little bit of detail on why that is. But the main reason is like music therapy requires like a lot more like experience doing in a higher level of degree in education. So in the class, our professor gave like a summary of the class, a summary of therapeutic music, and he uh, collectively kind of defined it as like therapeutic music uses music to enhance the environment. For example, the example he gave was playing music at a healthcare setting might be useful for healing or relaxation. Um, and that, like, this usually involves like performing at like a live concert at a certain setting, and like the possible benefits is like distraction of what might be going on, like relieving stress, reducing anxiety and blood pressure, and bridging connections between loved ones as well. Um, we're about to say something.
Which is interestingly, like if you recall our previous podcasts, that's what we've been talking about.
Right. So it's therapeutic music is a lot more of a broader, like just musicians in general could um, kind of dabble in this category. Um, it does better. It does better if like a person like there is like a way to become like get a certificate. Sorry, I'm stumbling over my own words here. But you can actually like, get a training in music therapy. Sorry, therapeutic music. Um, which might not be as extensive as being like a dedicated music therapist, which would take like a
Yeah.
like a master's degree to go into.
And you don't even have to be a musician to use music therapeutically. Even if like you listen to music just to calm down, like you listen to CD, that music is now therapeutic. If it helps you in any way, it's now therapeutic music. Um, So again, like what we've been talking about this whole time, and the focus of Live, Laugh, Lockdown has been to be able to provide people with knowledge and ways of using music therapeutically. Now, other side of the coin is music therapy.
Right. And our professor actually provided a definition from the American Music Therapy Association. How they define it is music therapy is the clinical and evidence-based use of music intervention to accomplish individualized goals within a therapeutic relationship by a credentialized professional who has completed an approved music therapy program, which usually these programs are tied along with either like a bachelor's degree or like a master's degree.
Yeah. Usually it's a master's, and it combines both music performance or just like a BMA or a music arts or music performance, and psychology as well, a bachelor's of science. You have to be learned in both music and psychology to become a music therapist.
Right. So we really want to stress that because of the fact that we are definitely not music therapists. We are in the school of music here. We're performers. So that's why we want to target it more towards like the therapeutic music side of it. So hard not to get these two things confused.
Not the two, yeah. You just have to remember you got therapeutic music and music therapy.
Right.
We are therapeutic music.
Right.
With that definition that Trevor gave, there are a couple in the class we took. We always focused on a couple points in that definition that help really narrow down what is needed for something to be considered music therapy.
Yeah. Yeah. And
Care
like,
to, yeah?
Yeah, I was about to.
Mhm.
And like the words are like clinical and evidence based, which is part of it, and then it's like music intervention, and then individualized goals. Um, and then the last one I would stress is like credentialed professional. Those are probably like
Yes,
three or
which
four.
we come, yeah, I always come back to. That's not what we are. So pretty much the definition means that the music therapy has to be a um, therapeutic method, like what the therapy is, because it is therapy. The therapy is a scientific based, and it's given by a music therapist, a certified music therapist, to an individual. It's not group. There can be group music therapy, but most music therapy is individual. It's between the music therapist and the patient.
Which actually goes along with the next point. Like in music therapy, there's generally like four main elements of it. And the first of the four is individualized music experience. So, which is like caring for like a specific patient. And then it's like a systematic delivery, a credentialed music therapist, and then a therapeutic relationship. And just to make sure that like um, they'll make it like more clear. I'm going to like provide some examples of both. So like two examples of therapy music is like practicing yoga with while listening to music so you can possibly clear your mind, or like playing piano in the lobby of a hospital. That's two that our professor provided, and then another two that of music therapy that our professor provided was working with the patients with Parkinson's disease. So that requires like a very high level of understanding of psychology and at least some level of understanding of music. And then another example is working with patients, hospitalized patients to reduce pain.
So why don't we start with, since most of the therapeutic examples we've have been our previous podcasts, and um, those are examples of how music can be used therapeutically. Um, this discussion is more focused on whether a musician's job, what they do, is therapeutic or therapeutic music or music therapy. But for you to have therapeutic music, all the previous examples in our podcasts have been therapeutic music. So we're going to focus on this podcast more on music therapy, just to give people an understanding of what music therapy is. Since it's also music therapy has been around for actually a couple decades, but it's not been until more recently that it's been identified as a viable field. You can get more colleges are offering it as a program, and not just a certification, but like an actual like degree you can get. So we want to be able to let you guys know what is music therapy. So why don't we first start with the Parkinson example?
When like looking at like a person with like Parkinson's, they would kind of have like a systematic level of steps of like seeing what the individual needs, and then going from there, like they might look at like what genre of music they particularly like, and like maybe from that point on is like getting them to move um, or kind of have like some activity alongside the music to help them kind of like either either get them to like trying to find the word, like to kind of like help them with memory, for example, or get them to
Mm-hmm.
like move in a more consistent manner as well. And then they will go back and like reassess, and then they'll go through that process again. So it's like very much like a scientific method type of way of doing it. And I think that's like a key thing, which is like therapeutic music, which it might not be as like scientific by the book type of thing.
Mm-hmm. The interesting thing is for while it's the program, the music therapy is always individualized, but there are a lot of times when it's treating the same issue or disease, the main method is often very similar. For Parkinson disease, especially targeting dementia, a lot of times, as like Trevor mentioned, the therapists will find music from uh, sometimes their childhood or when they're young adults, and play that. And what it's been discovered is that a lot of memories can come back listening to time-specific music, um, which I think, slightly off topic, it'll be really interesting to see what our generation sees as our like what music will trigger our memories. But for a lot of the times, the patients with dementia, usually it's like 40s music. It can be any genre of music, and it might not even be a time specific, but like as Trevor said, just a genre they really like. Um, and it usually helps them emotionally as well, not just bring back the memories, but helps them emotionally too. And then the other aspect is getting them to move, listening to music, dancing, just move. Even if it's not able to stand, tap a finger, just wiggle their body.
Yeah, just things along those lines of just moving or something like that. I remember with a specific example, with like a documentary that we watched, was an elderly woman actually listened to like lot of Louis Armstrong as a child, but then when she ended up getting dementia, she had a hard time remembering all that stuff. But then they played Louis Armstrong for her again, and then she was able to like talk for hours about stories of her childhood and everything like that. So I believe it like really works. It really.
We've had lots of even not given under music therapy, but other like family members have done that as well, where they'll play music that their parents loved. So very similar in that it's and like this is where the issue of like or the debate about music therapy versus therapeutic music. A family member can do the exact same thing where they take music from their childhood or young adulthood and give it to let their parents listen to it, and they'll have memories come back. But because the family members are not certified music therapists, it cannot be considered music therapy, but therapeutic music, which I mean, if it like that can still help people. Like just because therapeutic music isn't certified by by a therapist doesn't remove the benefits of it at all. It doesn't lessen the benefits. Yeah, another example that I can't remember what the therapy was called, but there was the music therapy that helps people regain or be able to walk.
Yeah, I don't remember
Yeah,
either, but
I don't remember what the therapy was called, but pretty much if a person had was in an accident that impaired some of their walking ability, not paralyzing them, but just made it difficult for them to walk. There was a music therapy that could be applied to help them regain a safe walking or like a safe gait to walk in. And a lot of times it involves bells, like little like bells you can tap on the ground. Um,
oh yeah,
or it might that's if like they need help lifting their legs up, if they have to lift their legs up to tap the bell. Um, or a music therapist will be playing guitar at a steady tempo to get the person to walk in tempo, and then they would increase the tempo a little to get the person to walk faster. Um, and I thought that was really cool. The fact that since, as we've talked about before, sometimes we like naturally start walking in tempo to music we listen to. And it's just like, for me, really cool to see that that's actually something people use to help regain safe walking habits.
yeah. Since I like for me, I never really realized that that could be used like that. Since like I just kind of thought it was just like a weird like kind of thing for like I thought it was like relatively like not important, but it showed that it actually is more than meets the eye. That was accidentally a Transformers reference that was on accident.
I don't know or don't have much knowledge on music therapy. Maybe I have a tiny bit on therapeutic music a bit. Um, but basically my personal experience was just with therapeutic music in general. I think it's just that's how we function in life in general, especially during these difficult times during COVID. We're just trying to find ways to keep ourselves occupied and just stay calm out of this crazy moments that we're going through. And for me personally, it's obviously either, I always say, listening to anime music or just watching anime, or like maybe it's like, I don't know, we were in entrepreneurship, we were doing a project where we had to make where we had to do these recordings and then send it to, I think it was Asbury Towers, was it?
Yeah.
Yeah, and we were all like assigned to do different pieces.
Which, for people who aren't aware, Asbury Towers is a retirement home here in Greencastle.
Mm-hmm. And the thing that I think I found therapeutic, it wasn't even there. I don't think I find it therapeutic for the musician, but I do find it therapeutic for the people who were the people that we were presenting it to, just because they can't see their families at the moment and they're stuck in these difficult times as well, and they're at a higher risk of possibly catching corona. And for them to hear music coming from like students at the or a part of their community, I think it really meant a lot to them, and it just kind of helped them calm down a bit. And I think that's what we're doing ourselves in general, even now, through this stressful time. But music there, or therapeutic music, is always something that we're trying to find. We're trying to find exactly. I'm just like switching it. Therapeutic music is what we're constantly looking for every day.
I was actually like thinking about my tendency to like listen to more upbeat music when I'm just like going from place to place, and I was just like, oh yeah, that I believe that like more upbeat music like reduces stress and like the blood pressure, which I think Gabby said at some point. So like I was just like, yeah, since therapeutic music is like more kind of everywhere, like so it's just like even if you don't notice it or not, if you notice it or not, it's like just always kind of just there.
Yeah, that's kind of the point of that was the point of this series, the Live Laugh Lockdown, was to help listeners, you guys, become aware of therapeutic music. Even though we didn't tell you what it was until this episode, we wanted to raise awareness of what this means. If you didn't know how music can help, you now know how music can help you emotionally, physically, mentally, and that now you know the name or how to the term therapeutic music. So this does unfortunately round off the end of Live Laugh Lockdown podcasts, but we will be releasing a workshop where we will be playing music and then talking a little more about practical side. So this was all like we were theoretically talking, and with the workshop we will be playing music so you guys can actually hear it and hear it in practice. So make sure to come back next week to listen to the workshop. Thank you all so much for listening in. We hope that you're all safe and continue to stay safe. Get a vaccine if you can, and if you can't, make sure to continue being protective of yourself and others.
Wear a mask.
Please.
Wear a mask. Yeah.
Take care of yourself.
Stay safe. Take care of yourself. Take care of yourself physically. Don't catch any illness, but also take care of yourself emotionally and mentally.
Don't be stupid.
All right, thanks, guys. Yeah, don't be stupid. Also, like, trying to stay together.
Sorry.
All right, guys. Thank you for tuning in. Bye.